Welcome, everyone. We'll get started momentarily. Good afternoon, and welcome to the Information to Help Tribal Communities webinar. Before we begin, I'd like to highlight the main features of your Zoom webinar interface. At the bottom of your screen is the Zoom menu bar. Here you will find the Q&A box. We encourage you to use this feature to submit any questions at any point during the webinar. We will leave time for Q&A after each presentation. At the bottom of your menu bar, you will also find a chat box. Please use the chat box to report any technical issues you may be experiencing. We will respond to those concerns as they come in. Additionally, live captioning is available during today's broadcast. Simply click the CC icon from your bottom menu bar to use this feature. Finally, please be aware that today's webinar is being recorded. With those announcements made, I will turn it over to our host, Lena Rashid.
Great, and good afternoon, everyone. We are really excited that you're able to join us, and we wanted to welcome you to our call today. This call is being hosted by the Center for Consumer Information and Insurance Oversight. We nicknamed ourselves CCIO, and the CMS Division of Tribal Affairs, and we're joined by our colleagues, Rachel Peterson and Katie Marks today as well, and so we appreciate their partnership in this. So my name is Lena Rashid. I'm a Senior Policy Advisor at CCIO, and I'll be moderating our call today. I think you already heard a couple of housekeeping items in terms of how to submit questions, but we wanted to do a few more. So we wanted to remind folks that this call is intended as a technical assistance call for organizations and individuals working with tribes. It is not intended for press purposes, and it is not on the record. If you are a member of the press, please email our press office at press@cms.hhs.gov. Also, we wanted to note that the information presented on this webinar is informal technical assistance and is not intended as official CMS guidance. So on today's webinar, we have a number of exciting topics and experts to speak with you today. We'll be highlighting the recent policy changes that may impact American Indian and Alaska Native communities, including the special enrollment period that is now open from February 15th to August 15th. As you can see from some of the speaker backgrounds, we're very excited about this opportunity. It's one that tribes get to experience all year round. But for those in mixed status households, we're really glad that folks will have this additional opportunity to enroll in coverage. We are also going to talk about CMS outreach efforts, and we will also talk about specifics in terms of how the American Rescue Plan Act will reduce healthcare costs, expand access to coverage, and ensure that hopefully everyone who buys coverage for the individuals and families can receive a credit and hopefully get reduced premiums. We will also have a presentation by a colleague on enrollment of tribal citizens and other Indian Health Service from an expert in the field who works very closely with tribal communities that I will introduce later. So without any further ado, I'm going to start off with some of our CMS colleagues today. And so the first speaker we're going to be joined by is Ben Walker. His title is the Director of Open Enrollment, but he really plays a really integral and important role in making sure all operations for the marketplace are coordinated and works on a number of key operational issues. And he's been working really hard to make this law into a reality in terms of how the American Rescue Plan will be implemented. And he'll talk about some of the affordability improvements that I mentioned earlier. We'll also hear from my colleague, Lisa Wilson, who is a senior advisor at CCIO, and it also works on tribal issues with myself. I'm sure you've seen her face in some meetings and hopefully you've gotten a chance to interact with her. Not only is her expertise in kind of broad marketplace issues and tribal issues, but she actually works really closely with our Office of Communications as we kind of make sure the marketplace is available to everyone and get the word out on all of that. So you'll hear about some of the new campaigns that are going on right now. We're going to actually do a presentation and then QA after each presentation. So keep your questions fresh in your mind. Hopefully right after the presentation, if folks have questions, we'll get to cover some of those topics right off the bat. And with that, I will turn it over to my colleague, Ben Walker, who will do the first part of the presentation before kicking it over to Lisa.
Yeah, thanks, Lena. Good afternoon, folks. I appreciate the opportunity to join you today to talk a little bit about the provisions of the American Rescue Plan that impact the health insurance marketplaces under the Affordable Care Act. And we'll focus today on the federally facilitated marketplace platform. We'll touch on a little bit on the states that operate their own marketplaces, but spend most of our time talking about the FFM and healthcare.gov. So if we can skip to the next slide. So as you know, the president signed the American Rescue Plan on March 11th. There are obviously a huge number of provisions in the ARP that are important, but there are three in particular that really impact the health insurance marketplaces. And these three provisions, which we'll focus on today, combine to improve affordability for all consumers, including American Indians and Alaska Natives. At a really high level, and you've probably heard some of this before, but bear with me to make sure that we're all on the same page. The three major changes are: first, for 2021 and 2022 only, the law eliminates the 400% limit on premium tax credits. So prior to ARP, only consumers with income under 400% FPL could qualify for premium tax credits to purchase coverage through a marketplace. Now, for 2021 and 2022 only, that limit is gone. So some consumers with income over 400% will now qualify for premium tax credits. Now, it's important to note that the FPL limit is just part one of a two-part tax credit calculation, which I'll talk about more in a minute. So not everyone with income over 400% FPL will be able to get premium tax credits, but with the ARP, some will, and that's new. The second thing is the way that the tax credit calculation is structured is that for someone within the income range, which used to top out at 400%, as we just mentioned, but now has no cap for the next 2 years, the law has us look to see how much coverage in a benchmark plan would cost for them and compare that to a percentage of their household income, basically to figure out whether the law says that they need help to afford the benchmark plan. So this brings me to the second major change in the ARP, which is that, again, for 2021 and 2022 only, it modified the affordability percentages that are used to determine how much someone can afford. Specifically, it took a sliding scale that went from about 2% of household income for consumers at 133% FPL, all the way up to 9.83% of household income for consumers from 300 to 400% FPL. The ARP modified this to go instead from 0% to 8.5%. So what that means is that that consumer at 133% FPL now gets a tax credit that assumes that they don't need to pay anything for a benchmark plan. And the consumer at 300% FPL sees their contribution decrease from the 9.83% of income to the 8.5% of income. Now, based on our analysis, this is a pretty significant thing for a lot of folks. So if you flip to the next page, you'll see that this drops average premiums by about $50 per person per month, and results in 4 to 5 enrollees being able to find a plan on the marketplace for $10 or less per month after premium tax credits. Now, of course, the results are going to be very individualized, but those are kind of the overall figures that we put together looking at the entire population after the changes in the ARP. So if you go to the next slide, this talks again about the two provisions that we just discussed, removing the 400% FPL cap for 2021 and 2022, and also changing the contribution percentage for 21 and 22. Now, as you may have seen, we were able to get those provisions built and up and running on healthcare.gov for the states that use the healthcare.gov platform starting last Thursday, April 1st. So as we speak, as new enrollees come to healthcare.gov, call the marketplace call center, or work with an agent broker or certified enrollment partner, they will not have the 400% FPL cap, and they will see tax credits computed based on the updated formula. The same is true for existing enrollees. So as those folks come back and update their information, which we're asking that they do, they will see their revised tax credit calculation and be able to apply that to their coverage. For these two provisions, we don't need anything new from people. There's no new questions. It all sort of fits within the existing eligibility scheme. So all people have to do is come in, submit an application or update an application, and it'll just work. And again, that launched last Thursday, and so far it seems like things are going quite smoothly. There is a third provision in ARP relevant to the marketplace that we're still working to implement, which is that it specifies that for 2021 only, taxpayers who received unemployment compensation for 2021 have their income adjusted to make more folks eligible for larger tax credits, and in certain cases, cost sharing reductions, and to take folks who are currently ineligible for tax credits because they're under the 100% FPL floor and are ineligible for Medicaid because their state didn't expand, and make those people eligible for tax credits. This is more complicated to implement than removing the 400% limit and adjusting the contribution percentages. So it's going to take us longer to be able to implement this and get it up and running for the FFM. Our current target right now for that is early July, and we'll of course stay in close touch with folks to let you know as that rolls out. And moving to the next slide. Quickly, I'll also mention, and this isn't a marketplace item, but it is absolutely relevant to health insurance coverage. The ARP also includes a temporary subsidy to offset the cost of COBRA continuation coverage for folks who are eligible for that, as well as money for states that operate their own marketplaces to help them implement the provisions that we discussed earlier. This is probably a good time for me to also remind everyone that the states that operate their own marketplaces are all working on their own individual implementation plans. And so the ARP provision changes may be on slightly different timelines for each of those states versus what we're doing on the federal end. We are working closely with the state-based exchanges to provide support and technical assistance as they go through the development and implementation processes. Now, turning to slightly older news, as many of you know, as a result of the COVID-19 pandemic, the administration created a broad special enrollment period for consumers from February 15th through May 15th, and then recently extended it through August 15th to ensure that consumers have a full opportunity to utilize the provisions of the ARP. All the states are doing something similar, although some have different dates. And I think we can flip to the next slide here. Now, of course, members of federally recognized tribes, shareholders in Alaska Native corporations, and others on their marketplace applications already have access to an SEP. But we did want to mention this here in particular because the new SEP does provide quicker effective dates for plan selections and updates than the existing SEP for tribal member shareholders and their families. So specifically, the existing tribal member SEP, just to use shorthand momentarily, requires folks to make a plan selection or update by the end of the day on the 15th of a month for it to be effective on the 1st of the following month. The current broader SEP allows selections and updates through the last day of the month to be effective for the 1st of the following month. Now, we've already set up the system so that if a tribal member shareholder or someone on their application comes in during the SEP, they'll get the faster effective date. So no one needs to do anything different, change what you put on the application or anything. During that SEP, again, all the way through August 15th, folks will get those faster effective dates for new enrollments and changes. Now, before I turn it over to Lisa to talk a little bit about outreach, and I think we can go to the next slide here. I wanted to note that earlier this week, we released a progress report on the SEP. And the highlight there is that since the beginning of the SEP on February 15th, more than 500,000 people have signed up for health insurance, again, using the federally facilitated marketplace platform. And this is a significant increase over what we saw during the same time period in 2019 and 2020. Now, this number includes about 2,600 new enrollees who have the tribal or shareholder cost sharing provisions. Again, since there is a pre-existing SEP for those populations, as you all know, I expected to see less growth there in the beginning of our broader SEP, but we'll be very interested to keep a close eye on that as we progress, because that period that we counted the 500,000 on is before we implemented the new 400% FPL and affordability percentage provisions on April 1st. And those, of course, should also make coverage more affordable for folks in Indian country. And so we're excited to see what that means for enrollment and affordability among those communities as well. So I've already touched on the next slide. We can flip to it about effective dates. I think we're good there. So I'll hand it over to Lisa here to talk about outreach, and then we'll be happy to take a few questions if folks have any. Thank you.
Awesome. Thanks again for the opportunity to be here. It's exciting to see many folks joining us from across the country. So we are conducting a national consumer outreach campaign with the goal of increasing awareness among the uninsured that there is this SEP that is now available to them, applying on healthcare.gov has been mentioned through August 15th for folks who are not members of federally recognized tribes or shareholders, of course, for folks in many folks throughout Indian country, that opportunity is available every month. But one thing that's exciting is that as this campaign is out there, we're hoping that many of the folks in Indian country will become increasingly aware of these new opportunities. So this campaign is there to increase awareness among the uninsured concerning affordability, and also to guide those who show interest through the enrollment and plan selection process to find coverage that meets their needs. One thing that we are very focused on right now is increased awareness among demographic groups with traditionally lower access to healthcare. For sure, the folks who have come in with this administration have been very focused on ensuring access for folks in that group. We are also looking at target audiences for like uninsured consumers through their gig workers or those who may have lost coverage in 2020 or 2021. Next slide, please. And so, you know, what are we saying? If you have had any opportunity to be online, I know a lot of folks did see many of the commercials, in particular during the NCAA tournament. For those of you who are basketball fans out there, I know I saw it several times. And people are seeking health insurance, can go to healthcare.gov right now to enroll through August 15th because of a special enrollment period. We are talking about things like 9 out of 10 people who enrolled got financial assistance. 3 out of 4 currently enrolled can find plans for $50 or less. So I'm sure that those are head-turning messages for many people. It is increasingly something that we are trying to make sure folks understand the deals that are out there. So, you know, we reiterate, go to healthcare.gov to learn more. And in particular, if you're recently uninsured due to job loss or between jobs, you can find a plan at healthcare.gov and keep it for as long as you need. Next slide. So, you know, one of the questions that we get a lot is, so what do I do? How do I access this? You know, and so we do have a ground game. We have consumers can work with over 51,000 licensed agents and brokers who are registered with the marketplace and over 8,000 trained assisters ready to assist consumers with their application for coverage. You can go on to our healthcare.gov find assistance page to get help applying for coverage. There are 2 options there to receive local marketplace certified enrollment assistance through this website. You can, 1, search for a list of agents and brokers or assisters in your area, or there's a really cool option where you can get contacted. You put in your information and a marketplace registered agent or broker calls you back. And, you know, here's some more information about the services provided by both agents and brokers are free to consumers. Generally for the agents and brokers, and they have to be licensed. On the assister side, they are free to consumers and not paid for by insurance companies, and they can help with enrollment in marketplace plans. But as well, they have expertise in providing support to consumers who are found eligible for financial assistance through or Medicaid or CHIP. Next slide, please. We did recently make additional money available to these Navigator grantees in the form of some supplemental grants, given the increased workload as folks are helping people through the special enrollment period through August 15th. And, you know, also have announced plans to invest in the future of the Navigator program and increase funding significantly for the upcoming 2021 Navigator Notice of Funding opportunity. So that's the end of my presentation, and I know Lena and Ben and I are ready to take some questions.
Yeah, we've received a number here in the Q&A function, so thank you so much for using that, and I'll go through a few here, and we'll have more time, I think, as well as a more additional presentation following this that may help answer some questions as well. The first question here was, can we just input 133% of FPL as household income in order to get the unemployment provision before it's implemented? The answer to that question is no. We really strongly recommend that people do not attempt to manipulate income. There's a variety of reasons for that, but the one that I'll state off the bat is that could then cause later problems for folks who are going through the annual redetermination process because we won't know what their real income is. And we wouldn't want folks to get an incorrect eligibility result potentially down the line because of that. We are definitely aware that folks are looking for that unemployment provision. We're working as hard as we can to get that out there, and we'll make sure that we have a kind of comprehensive approach as soon as that is something we can make available. There was a next question about whether this changes anything about coverage effective dates, and are there situations in which this makes a retroactive coverage date available? The answer to that is no. None of this changes anything about coverage effective dates. From a retroactive perspective, as we mentioned during this SEP, which everyone qualifies for, we have a faster effective dates, although they're still prospective. And that is if folks make an enrollment or a plan selection by the midnight on the last day of the month, it is effective on the first of the following month. Good question about, was there any change in the law and eligibility, the rules around employer-sponsored insurance? And we actually got a couple questions on this. One was about people who declined it, and other was about self-only coverage versus family coverage. Congress did not make any changes to those provisions in the Internal Revenue Code. And so that all remains as it was. There's a question here about whether people who had a reconciliation repayment for tax year 2020, if they still have that, were they excused from that? And that's a great point. We didn't mention that, we probably should have. Part of the American Rescue Plan, this is over on the IRS side of the house, is that they did have a provision that said for 2020 only, for folks who had a premium tax credit reconciliation repayment, that they no longer have that. We have been asking, and understand IRS is hard at work on many things, but including getting some guidance out on this one so that folks who have already filed know what to do, and folks who have not yet filed know what to do. And so look for that from IRS, we think, very soon. This question here about whether this changes anything about kind of eligibility for the benefits specific to tribal members and shareholders, and specifically are now descendants potentially covered. None of that changed. So the American Rescue Plan, very broad changes kind of out there for everyone. And so the specific benefits that are there that are in the law for folks in tribal and related communities are all still there, and the eligibility for those has not changed. There's a question here about eligibility for zero cost sharing plans. Again, this is not something that was fundamentally changed by the ARP, but there was a request to clarify that for the special cost sharing rules for folks with income under 300% FPL, that is total household income versus person specific income. And that's absolutely right. All the income calculations for marketplace eligibility and enrollment are based on annual household income. So everybody in the tax household, added up with all of those various rules. For outreach, is there an accurate way to generalize up to what FPL most people will now get a premium tax credit? That's a great question, and definitely one that we had as well, right as soon as the bill passed, because same reason you're asking, outreach, right? It's very helpful to try to have these kind of clear messages. This is a really tricky thing to figure out because of the nature of the tax credit being variable based on the people in the household, not just income, of course, but how many people are requesting coverage, what their ages are, and where they live, because ultimately receipt of a tax credit is dependent on how much the premium for your benchmark plan is, and then some other things. So I don't know that I have a great clear answer for this. Lisa may have some thoughts. What we've done is we have those general messages that you've seen. The other thing, which hopefully is helpful, is that in addition to updating the marketplace application, we have updated the what we call kind of the window shopping tool, healthcare.gov/C-plans, SEE. And that's where people without logging in or creating an account can go put in their age, put in their zip code, put in their income, and get premiums. And so I would definitely encourage folks certainly to use that if you aren't already, but also play around with it a little bit in your specific geographic area. I think that can help you give a better sense of where you are, how things might work. Lisa, any other thoughts on that question?
That is the best advice I could give too.
All right, great. Clarification, is the affordability standard for declined ESI still based on the cost of the policy for the employee? Yes, nothing in the law changed the Internal Revenue Code sections about employer-sponsored coverage.
And Ben, I'll give you a second to breathe and pause, since you've answered so many questions already, and hopefully we'll answer some more. A lot of you have asked about whether this presentation will be posted. We will certainly share with you all if we're able to post the specific PowerPoint, but we did want to let you know that since this webinar is recorded, it'll be on the All Tribes Call and Webinars page. I'm going to put that page, that link into the chat for folks. I wanted to make sure folks were aware of that.
Thank you. How long will the 400% rule be in effect? In the statute, the ARP, it is for 21 and 22. So this year and next year. If a person doesn't come in who's enrolled and update their information, can they get the kind of increased tax credit when they claim taxes for 2021? Yes. So if a person is enrolled in a plan through the marketplace, when they file their taxes at the end of the year, and I know many of you are familiar with this process, if they sort of didn't get enough, you get the extra amount up to the premium. And if you got too much, then you have a repayment. And so if somebody was theoretically eligible for more under the ARP, provided that they're already enrolled in the marketplace plan, when they file, they'll get that increment back on tax filing. Just looking through, see which ones we've taken care of here. Go ahead.
And Ben, while you're doing that, maybe we can have Lisa answer some of the outreach questions.
Yeah.
Absolutely. So thanks so much for writing a couple of these in. The first one is, are there any approved marketing posts for our social media pages for those of us who are health markets agents? And I will look for, we have a landing page on our marketplace.cms.gov area that is like a partnership webpage. It actually has a ton of fillable flyers as well as other materials, including some suggested social media posts. So I'll drop that into the chat in just a second. The second question was, did tribal assisters and navigators receive funding, or will there be a set aside for tribal assisters? So the money, the $2.5 or $2.3 million that I mentioned earlier was actually a supplement to the grants that were made last summer, fall, August of 2020. And so, instead of being, specifically directed to tribal communities, they were ones that were available to the navigators who are already in place. We will have a new notice of funding opportunity that will be coming out soon. And for that notice of funding opportunity, we absolutely invite folks to apply. One thing that I know has been a problem in the past, and many of the folks who we work with regularly, in particular on TTAG, have talked to us about some issues there around the requirements to serve all applicants, and many of those do end up being like statewide coalitions and stuff. So I think there is some nuance there with the NOFO, as we call it, the Notice of Funding Opportunity, with that opportunity. So, happy to have folks apply, but just making sure folks understand the nuances there. And then finally, it sounds like that there's a person on the line who has been registered on Help on Demand. That's the feature that I mentioned, where you can get called back by a licensed agent or broker, and has only gotten 2 leads. I am actually happy if you want to send me an email. I'm lisa.wilson@cms.gov. I'd be more than happy to pass it along to our team. Feedback like this helps us improve, and the whole point is absolutely to make sure that we're connecting consumers and agents and brokers. And so I'd love to connect and hear a little bit more about that experience, and I can pass it along to the team who manages that.
Okay. I want to make sure we have time to get to the next presentation. Lena, do you want to go to that or do you want to do some more questions? Whatever you think is, want to use folks' time well.
Great. Yeah, I think we covered a lot, and I think hopefully Danik's presentation may be able to cover some of these additional questions. And hopefully we can go from there. Reminder, I know there's some more questions coming in on the replay. We're going to put that link in for when it's up on the website, and maybe we'll try to get an email out to folks as well. So with that, I wanted to thank Lisa and Ben, and also thank you all for your questions. They were robust and they were detailed, and they show that you really know your stuff and you're out there to help the community. So we really appreciate it. And so next, I'm going to pass it over to Danik McDonough, who I think some of you have probably heard from in the past. He's a consultant with the Tribal Self-Governance Advisory Committee, and he's been advising tribal communities on different ways to maximize opportunities under the ACA and under the Indian Healthcare Improvement Act. He has a number of roles where he's working with tribal communities, but I'll highlight a few, which are that he is a technical advisor to the Tribal Self-Governance Advisory Committee and the Tribal Technical Advisory Group to CMS. And so we get to work with him in that capacity and are excited to have him speak today. So you'll hear some information in more detail. You'll hear a little bit about the American Rescue Plan and special enrollment periods, and hopefully some information to help engage with tribal communities and also assist folks with enrollment. So with that, I'll turn it over to Danik, and thank you for being with us today.
Thanks so much, Lena. Appreciate the opportunity to present and to build off of the presentations that Benjamin and Lisa just made. Just as a quick note, if you see on the slide that's on the screen, the Tribal Self-Governance Advisory Committee has a host of information on their website, tribalselfgov.org/health reform. The presentation I'm giving today will be on there as well. And I've got my email address there. If you have any questions on the material I'm presenting, feel free to kick me an email. Next slide, please. As reference, I just have a whole bunch of acronyms there. Just want to point out on top the AIAN abbreviation. I'll try to make sure as I go through to clarify when we're talking about enrolled tribal members and other IHS eligible individuals or solely enrolled tribal citizens. So that's an important distinction as we talked about the marketplace provisions. And the other items there are just for reference. Next slide, please. Just for reference, the current federal poverty level figures for 2021, they happen to use the 2020 ones the way it works. So 2020 FPL levels are the ones that apply to the marketplace eligibility determination there. Next slide. Just a couple of the basics on tribal sponsorship. Tribal sponsorship is the purchase of health insurance coverage by a tribe or tribal health organization on behalf of tribal members or other IHS eligible individuals. We're going to focus on the marketplace and in particular the American Rescue Plan provisions as it impacts sponsorship, but sponsorship's used more generally as well for Part B and D in Medicare as well as for private insurance. The goal of sponsorship, why would we want to bother with it? It's to generate additional resources to meet the healthcare needs of tribal members and to make health services more accessible to tribal members. The mechanisms for doing it, and we'll go into more detail through the presentation, is through tribal sponsorship, the tribe pays a portion of costs, part of the insurance premium, and the federal government contributes an even greater amount to the cost of care. And that's both for subsidies for the premium, so making the health insurance coverage more affordable, as well as paying for out-of-pocket costs, cost-sharing amounts on certain circumstances in terms of eligibility. Typically, tribes that are operating sponsorship programs realize about $4 to $5 in new additional resources for every $1 that they invest in the program. So it has turned out to be a very useful program approach to gaining access to health care resources by sponsoring tribal members, whether they're enrolled tribal citizens or other IHS individuals in the marketplace. Next slide, please. Here's an example of where you might consider sponsorship. You're running a PRC program. A patient who's uninsured at your clinic needs a MRI. So your folks look, and the cost of an MRI procedure at Medicare-like rates would be $364 for this patient. Says, all right, we'll approve that. That's within our guidelines. But hey, what if we enrolled the folks in the marketplace and not just securing an MRI, but securing health insurance coverage for the whole year? In this example, and as Benjamin mentioned earlier, the costs for premiums in the marketplace with premium tax credit is based on a number of factors. Where do you live? What are the insurance premiums? How old are you? How many folks are in your family? How many of those folks are enrolling in the marketplace with you? What's the income of your family? So it's a lot of variables. But this example of a 45-year-old individual in Rapid City, if they were to enroll in the marketplace, it would cost $391 to get coverage for the year. So the tribal health organization may say, wow, I'm not just going to go refer them for an MRI and pay out of our IHS funds. I'm going to enroll them in the marketplace at $391, and then they get coverage for the year. The numbers in Rapid City happens to be for that 45-year-old on average is about a little over $10,000 a year on average paid out in healthcare costs for 45-year-olds that enroll through the marketplace. Just a point to build on the special enrollment period mentioned before, as you know, enrolled tribal members have a special enrollment period that's permanent that you can enroll any time of year. Other family members can enroll along with them as well, even if they're not enrolled tribal members. The change, though, for the special enrollment period that was announced that extends through the 15th of August is beneficial in two ways. One is IHS eligible individuals can enroll throughout the year versus previously it was only have that special enrollment period when they're with an enrolled tribal member. And secondly, that effective date is very important. If you're can on the last day of the month enroll in the marketplace, it will be effective the first of the following month. Under regular time, if you enroll by the 15th of the month, the next month on the 1st, you start. If you enroll after the 15th, you could wait up to 45 days for the effective date. So those two provisions are really helpful, even with American Indian and Alaska Natives having the special enrollment period in the ACA itself. Next slide, please. Just to summarize the benefits of sponsorship, it's under the label of advancing sovereignty for tribes and tribal members. Overall, greater resources are available for tribal health services as the new federal resources are accessed. Specifically, three primary benefits: increased third-party revenues. When you're providing care to a otherwise uninsured individual, you're then bringing in the revenues once that individual is covered through the marketplace. Two, for uninsured individuals, when you're referring them out through the PRC program, no longer will the PRC program pick up those costs. They'll be picked up by the health insurance coverage. And then third, expanded access to health services for American Indians, Alaska Natives. If they go outside to get care, they will not have to go through the PRC process restrictions, which may not authorize a particular service, even though it might be necessary. So benefit number three. Additionally, tribal members experience reduced costs, whereas out-of-pocket costs that sometimes may be picked up by the tribe, other times it may not be picked up. If you're an enrolled tribal member enrolling in coverage through the marketplace, you have comprehensive cost-sharing protections, which we'll talk about in a minute in more detail. And then overall, this notion is tribal health organizations receive funding from IHS, but that funding is limited to the defined amount that's allocated out. By enrolling in the marketplace, the tribe's able to take a piece of that funding and move it over to the marketplace and getting full coverage, which creates a mini entitlement for that individual for all the healthcare needs that they might have. Next slide, please. And just monitoring enrollment from year to year, this is a measure of how many American Indians, Alaska Natives who are enrolled tribal citizens and other IHS eligible individuals have enrolled through the marketplace. You see the dark blue are enrolled tribal citizens in the federally facilitated marketplace states. The graded color there are other IHS eligible individuals in the federally facilitated marketplace. And then the third bunch is enrolled tribal members in state-based marketplaces. We're missing the piece of other IHS eligibles in the state-based, but that data is not available. You see a steady increase from year to year in overall enrollment, and in particular for enrollment of enrolled tribal citizens. In 2020, there was an increase of 2.7% of enrollment in the marketplace. That compares to roughly flat enrollment for the general population. 2020 was the first year where we surpassed the 100,000 mark for enrollment of tribal citizens in the marketplace. Just want to compliment the folks that are working on the front line to get folks enrolled. And we know that each year you have to re-enroll them. And throughout the year, you have a lot of hand-holding for folks as they're in the marketplace so that they maximize their health services that they're eligible for. Next slide, please. Just to put it in context, where does the marketplace fit in the whole scheme of funds coming to tribes, either to IHS or to tribes that have taken over programs? There's the longstanding congressional appropriation in the mid-70s. Medicaid and Medicare allowed tribes, tribal health organizations, IHS to bill for services. And now, in addition to that, Medicaid, Medicare, and the IHS appropriation, there's the subsidies available through the marketplace. Tribes, if you want to do sponsorship, they're authorized to use the congressional IHS appropriation, third-party revenues, or other funds that are available to the tribe to do the sponsorship. Two primary areas for the federal resources: premium subsidies through tax credits, and then the out-of-pocket protections. So for enrolled tribal members, different from other IHS individuals, for enrolled tribal members, there's 100% cost-sharing protections, meaning no deductibles, co-payments, or co-insurance when receiving services through marketplace coverage. There's two types of that 100% coverage, and we'll talk about it in a minute. But overall, whatever your income is, enrolled tribal member enrolled through the marketplace is eligible for the 100% protection for cost sharing. Next slide, please. Mechanically, in terms of how does sponsorship work, this is a bit simplified, but the first scheme there is showing Medicaid enrollment. Tribe helps the member enroll, the member gets care, and the providers get reimbursed. Under sponsorship, tribes help folks enroll. The next step is an added one, which is if there is a premium, the tribes pay that premium on behalf of the sponsored individual. The individual gets care, the providers get reimbursed. So it's pretty straightforward in that way, although given that there are tax credits involved and things, it's a bit more complicated than laid out there, but that's the grand, that's the simple process going across. The last point on that slide is tribes and tribal health organizations are able to establish their own eligibility criteria that they want to apply to their members. They might say we want to sponsor anyone eligible for tax credits or anyone up to a certain income level, whatever rules that they want to apply, as long as they're within the parameters of the funding source restrictions on that. Next slide, please. So sponsorship programs aren't limited to sponsoring people who are eligible for tax credits, but oftentimes that's part of it. So the next two slides will just talk about eligibility for tax credits. But the second part of a benefit of marketplace enrollment are those cost-sharing protections. With even if you're not eligible for tax credits, the cost-sharing protections are very valuable too. So general eligibility in the marketplace: you reside in the state of the marketplace, you're in the country legally, and you're not incarcerated. Next slide. Second, going through eligibility in the marketplace, we just talked about eligibility for tax credits here, showing one key change that was mentioned by Benjamin: have household income, which was between 104% and 100% of the federal poverty level. But for this year and next year, it's have household income at least 100% of the federal poverty level with no cap 400% there on the top end. Second is you're not eligible for Medicare, Medicaid, or affordable employer coverage. The family glitch, there's questions earlier about any changes. There are no changes in the American Rescue Plan related to employer coverage and how that's all considered. Veterans are eligible for marketplace premium tax credits and sponsorship as well. It's important though that they're not enrolled in the Veterans Healthcare Program at the same time. That creates conflicts. There are no Indian-specific criteria for the premium tax credits. There are, though, for the cost-sharing protections. Next slide, please. I'll do a high level because it's covered by Benjamin, but in terms of the eligibility, the provisions for marketplace coverage, premium tax credits, just to walk through those once again. And I've got a graphic here that I borrowed from the Kaiser Family Foundation in terms of comparing at income level what the applicable percentage is for the household contribution. So just to walk through, there's three sections of the American Rescue Plan, 9961, 9962, and 9963. So 61, first it makes more persons eligible for premium tax credits. As has been mentioned, the cap at 400% for subsidies has been eliminated. So that goes up without a strict limit on that. Second is it provides more generous premium tax credit subsidies for those that have been previously eligible for the program. So if we look on the chart here, look on the line, let's say for 200% to 250%. So if we look at 200%, move over to the middle, you would be expected to contribute 6.52% of household income in the formula for determining how much you earn in premium tax credits. What is the premium tax credit amount? If you move over to the right, that 6.52% is now 2% of household income. And you can go through and see the different figures there. So really a substantially more generous subsidies for premium tax credits. We'll talk about it in a minute later, but just to mention here, there is the dynamic, a positive one, that when tribal members enroll in the marketplace and they're eligible for the comprehensive cost-sharing protections, while these premium tax credits are based on enrolling in the second lowest cost silver plan, it's recommended that enrolled tribal members typically enroll in the bronze plan that's cheaper, which makes the tax credits go further, which makes the net premium cost to enroll tribal members to be lower. So there's a positive dynamic there. Section 9962 pertains to 2020 tax year only and eliminates the requirement to repay all or a portion of any excess premium tax credits. So tribal sponsorship programs that may have needed to reimburse enrollees because there's an amount owed at the end of the year, the enrollee will not have that amount owed, and the sponsorship program will not need to reimburse them. Next slide. Oh, I just want to mention on the previous slide, there's a link at the top to the CMS webpage where they have very helpful information, guidance information, FAQ kind of information on the American Rescue Plan if you want to access that. Next slide, thank you. And then the final provision there, just to mention in the American Rescue Plan, relates to unemployment compensation. As mentioned, disregards household income above 133% of the federal poverty level. So basically, it depends what plan you pick, but you can secure a silver plan for zero premium at that level. And secondly, extends premium tax credits to individuals below 100% of the federal poverty level that have unemployment compensation for at least 1 week in 2021. Does that solely for the current year, but that's another important provision. So folks in states without Medicaid expansion, that's a very helpful provision to have. Next slides. So on this slide and the next couple slides, just want to make a comparison to what subsidies for premium tax credits look like prior to the American Rescue Plan, in a sense, the baseline Affordable Care Act, and then with the American Rescue Plan. We have a couple scenarios from different places, and again, every place has different, any geographic place has different premiums that are offered, different plans on the marketplace, and it's based upon how many folks in the family, how many enroll, your income, things like that. These things vary. The example here, though, is from Rapid City, South Dakota. If we look at the solid line, what we see is just to back up for a second, this is for individuals who are enrolling in a bronze plan. Enrolled tribal members, again, have no out-of-pocket costs. The recommendation is they enroll in the plan, which would have the greatest out-of-pocket costs, which means the premiums are lowest, but the federal government picks up all those out-of-pocket costs. So these are net premium costs to enrollees in the marketplace under different scenarios than enroll in bronze plans. So we see with the solid green line there, from 100% of the federal poverty level to the household income, a little bit over 250% of the federal poverty level. In the prior, even before the American Rescue Plan, the net premium cost to that 45-year-old individual was zero. If we look, then we see the solid line kind of angling up. It goes from the zero up to a little over $2,000 would be the net premium cost for that individual if they enrolled in the marketplace, up to a household income of 400%. At 400%, the net premium cost kicks up and actually goes to the full premium without any subsidies because of that 400% limitation on eligibility for premium tax credits. If we look now at with the American Rescue Plan with the dotted line, we see the zero premium continues to about 340% of the federal poverty level. So this individual, you look on the chart that we had earlier, if they enroll in the marketplace and their income could be up to 340% before they have to have net premium costs above zero. Then you can see the angling there. It goes from that zero up to about $6,000 when you get to 800% of federal poverty level versus paying the full premium. So this kind of gives you a snapshot for a one-person household, what the impact of the American Rescue Plan is on the net premium costs rolling in a bronze plan. If we look at the next slide, this is for in Rapid City, three-person household, 3 enrollees, what it looks like. You can see the solid line with the hard stop, in a sense, full premium payment at 400%, but almost no premium before that. Now we see that household income, if you go all the way up to 800% of the federal poverty level, still is for this family of 3, maxing out at $6,000 versus full premium payment of $20,000. So the family size, income level all matters, but the income, the net premium cost impact from the American Rescue Plan is pretty dramatic. If we look on the next slide, and I've just got a couple slides left, there's a different way to kind of present the information about net premium costs. Here we're looking at enrolling in the marketplace in Nebraska and looking at the net premium costs with the American Rescue Plan subsidy levels, and pick your choice there about where you want to see what the net premium costs are. Let's say you have a 2-person household, 2 enrollees in the marketplace in that household, and they're making 600% of federal poverty level. I'll look under that's about $102,000 if I got my chart correct. They would be paying about $1,800 a year in total for the 2 family members to get coverage in the marketplace, even at that income level. Below that, you can see at 300% and below, in all the different scenarios of family makeup, the net premium costs are zero, showing there. So some programs doing tribal sponsorship say, hey, we don't have a whole lot of costs to do subsidies right up front with the premiums. So why don't we pick an income level, let's say 250, 300% of federal poverty level, where the net premium costs generally are actually zero. So it's only our effort to enroll folks and educate them, and little to no premium costs to get the program going. As we get savings and PRC program, if we get more revenues in, we can then expand the program to have additional funds to enroll higher income folks, and that would generate more savings and more revenues to the tribe and build out your program that way. So tribes might want to put together a table like this where they can then walk through it with leadership and say, hey, do we want to do a sponsorship program that would have a pretty modest investment to get a full coverage for an individual. Just for one last thing, and if we look at one person household, one enrollee, all the way down to the bottom, there's no premium tax credits. The premium would be about $6,541 for that individual in Nebraska. It's a 45-year-old individual. So that's the premium for a bronze plan, paying the full amount, which represents 60% of cost. On average, it's about $8,000 to $10,000 of healthcare services provided to enrollees who are 45-year-olds there. So for zero to modest investment, you get the full coverage, which happens to be $8,000 to $10,000 a year on average in health service payments. So the return to the tribes on their investment tends to be fairly positive there. Next slide, please. And Lena, I'm working to the end here to get through. Just want to touch base on the issue of cost sharing protections, and also to compliment CSIO as they've been working with tribal leadership on addressing one issue related to this. So here we have two little diagrams. The one on the left is if you're helping someone enroll and they want to have an eligibility determination for insurance affordability program. That's where you click a button right up front. Meaning, do you want healthcare.gov to help you figure out whether you're eligible for premium tax credits? So click the button yes, and then it gives you the information. Now, in that scenario, if your income is between 100% and 300% of federal poverty level, and this doesn't change with the American Rescue Plan, you are eligible for the zero cost sharing variation plan. That's what it's called. Has been named, zero cost sharing variation. If your income is below 100 or above 300, you're an enrolled tribal member, you're still eligible for these comprehensive Indian specific cost sharing protections, but they're referred to as the limited cost sharing variation. The difference between the zero and the limited is if a person with a limited cost sharing variation needs care outside of the tribal IHS system, they need to get a referral for cost sharing to go outside, to hand that to the provider, so that they can then pay no out-of-pocket costs. Both of them, the zero and the limited, are 100% protection for deductibles, co-insurance, co-payment. So it's really important that when you're communicating with providers and with the health plans, that it's that 100% protection. You need a piece of paper in the limited, but not in the zero when you go outside the system to get those cost sharing protection. The diagram on the right is, you could also go to the marketplace, say, I know my income is above limit or I'm not eligible for tax credits, but enroll me in the marketplace, and you would be an enrolled tribal member would get the limited cost sharing variation off the bat without consideration to what their specific income is. The one thing that CSIO has worked with us on and published, and it's at the end of the slides here, but is to get clarity for enrollees that if you're an enrolled tribal member and you're enrolling in the marketplace and you're enrolling with family members, you only want to enroll in the same health plan as kind of a family team if they are enrolled tribal members as well. Because if you enroll, as an enrolled tribal member enrolls with family members that are not eligible for the comprehensive cost sharing protections, then it is the least comprehensive, the least generous cost sharing protections that apply to everybody in that group. So go to the marketplace. It's helpful now as well. It gives you that information and clarifies why you want to enroll in separate plans. And it also suggests too, why don't these two individuals in your family that are enrolled tribal members enroll in this plan, and these other individuals in your family who are not enrolled tribal members enroll in a separate plan. The net cost on premium is no different, but it enables everybody to maximize what their cost sharing protections are from the federal government.
And Donig, I know we're getting close to time. I want to make sure folks have a chance to answer or get to ask a few questions.
Yes.
Do you want to continue going through, or do you want to pause and maybe we could do it?
I think I'll pause since I've gone off the time there. Thanks, Lee. Any questions?
Great. And so I know we had a couple of questions in the chat, so I'll let you take a chance to open those up and take a look at it. I know you'll be able to answer this question clearly, but folks asked about why is the 0-100% of household income subject to limited cost sharing variation? If you wanted to cover a little bit of that again.
Sure. Just for kind of the simple is the Affordable Care Act created this 100 to 300% for what we call the zero cost sharing variation, and outside of that, which is below 0-100 and above 300 above, is the limited, and that's just in the Affordable Care Act in the way it is. Again, the only difference there being if you have the limited cost sharing variation, you just need a referral from a tribal health or IHS provider when you go to a non-tribal or IHS provider, but you still have no out-of-pocket costs. Next, should I just jump into the next question here, Nina?
Yes, to definitely hit up whichever one you would like.
All right. When you talk about tribal sponsorship with IHS dollars, are you just referring to the tribes that have taken over healthcare services through the 638 process and IHS direct service facilities choose to pay sponsorship for IHS eligible beneficiaries? Great question. So IHS itself has decided not to operate its own sponsorship programs, but IHS partners with a tribe. If a tribe wants to set up under a Title I or Title V 638 process, if the tribe wants to set up a contract or compact where they're doing sponsorship, IHS then cooperates with them. So funds can then be transferred from IHS to the tribe to operate the sponsorship program. Thank you for the link. How do I get in touch with Dunnig about getting involved with tribes in Georgia? My contact information, email is on the front of the presentation. Feel free to contact me through there, and then tribalselfgov.org. It's got the general information on sponsorship, marketplace, and things. If the tribal sponsorship program drastically decreases the amount spent for PRC, would this impact the amount of PRC money the tribes receive from IHS? And the answer is no, it would not. It doesn't. The tribe would have the PRC funds then to continue operation of the PRC program, and then within the constraints of reprogramming, have the ability to move money where it is most needed. There's a lot of healthcare costs that are outside the traditional health insurance package, long-term care, substance abuse, things like that, which are very much needed. And so if PRC funds are freed up, there may be ways to then address unmet healthcare needs of tribal members. Why would tribal governments not choose to offer sponsored ACA insurance? That is the case with a particular facility. It's a decision for each tribal health organization whether they want to do sponsorship or not, and what those eligibility requirements are that they might want to put in place. Without getting too much off topic, I want to mention, though, there is now an ability for tribes as employers to access the marketplace through CMS rules that were implemented a little over a year ago. If someone wants to talk about that as a tribal employer, but what we're talking about here is tribes as tribes sponsoring individuals. There is a new access possibility for tribes to the marketplace and the cost sharing protections if a tribal employer wants to do that. How?
Dunnig, I think I'll pause there just in the interest of time. I know folks had a lot of questions. I think all the presenters have tried to do their best to try to answer some questions in the chat. And this is really helpful feedback for us in terms of future information we can try to provide to folks. I know folks were worried about slides, and there's still some questions coming into the chat, but we are going to make sure we share the presentation on the link that CMS Tribal Affairs has. I'm going to put that back in the chat again for folks to have. But we really appreciate folks joining here. We hope this information is helpful as you're engaging with tribal community. We're so glad that we were able to go over because there were so many questions, but we do want to be really sensitive to folks' time. So thank you all for joining and for your time. And we look forward to working with you on enrollment throughout the year and hope we can have more opportunities like this in the future. If this was helpful or if there's some other type of information that you hoped could have been covered, I'm including my email in the chat to everyone. And you can definitely let us know if you would like additional information in the future or webinars were like helpful or any other feedback that you would like to share. So with that, I will pause and thank you all for joining and hope you all have a great day.